Are we seeing, Dr. Labos, this third Omicron wave or a seventh wave earlier than we expected?
Yes, I think so. I think a lot of people were talking about cases going up in the fall. That was sort of the prediction. It's happening a lot earlier than people thought it would because of these new subvariants. Now, how big this wave ends up being, we'll see. But if Europe is any indication, it could be significant. Maybe not as bad as the original Omicron wave that we had December and January, but it could lead to a rise in hospitalizations. And we're already starting to see the beginnings of that. So definitely not something that we should be ignoring.
But it's also happening at a time when no vaccine requirements, no masking mandates, and little appetite for anything like that to return. So if it's on the individual, given what we're seeing with cases and these new subvariants, which are evading immunity, what do people need to do? What should they think about doing in their own personal actions?
Well, even if something is not mandatory, you can still do it. So if you haven't gotten if you haven't updated your vaccination status, update your vaccination status. Come the fall, when we likely will have Omicron-specific variants, then definitely do that. And wear a mask when you're in a public setting, especially if you're going to be indoors with a bunch of other people. A mask is probably one of the most effective and cheapest and least and has the least amount of side effects associated with it. So even if it's not mandatory to do so, I would wear a mask if you're going to be in a public indoor setting. I think there's almost no downside to that.
I have another question for you about COVID today. This was a new phenomenon to me that we haven't spoken about in our many months together. COVID rebound or Paxlovid rebound. Dr. Anthony Fauci was talking about this. He himself had COVID. He took that drug, and then he had a return of the COVID symptoms. And I understand that scores of patients have reported this as well. What is happening here?
So it's not entirely clear what's happening, but basically what happens, somebody has COVID, they take Paxlovid, they test negative, meaning presumably the virus goes away, but then they test positive again. And when you sequence the two viruses, it's the same virus. So it's not as if they got infected and got infected again. And it's not as if the virus mutated and became resistant to Paxlovid like antibiotics sometimes do, because it is the same sequence in the few cases where that's been done. So it looks as if the Paxlovid is suppressing the viral load so that it's undetectable on testing, but then the minute you stop Paxlovid, the virus shoots back up again, and so you stay sick for a few days longer. And this has really called into question how effective Paxlovid is. I mean, it probably is still helping, but it's not the miracle cure that I think a lot of people thought it was going to be. And this has raised questions of, well, are we starting it too early or too late? Is the timing wrong, or is the duration not long enough? Because remember, Paxlovid is a 5-day course. Well, if there's still replicating virus inside of you after 5 days, maybe Paxlovid needs to be taken for longer. So these are the questions that are being thrown around. We don't really know what the answer is yet, but just for people to know is that if you do take Paxlovid and then you retest positive a few days after you stop the treatment, that has actually been well documented and is something that is almost expected at this point.
It's so interesting, and as you say, there's a lot of study on an ongoing basis. Why exactly is that happening? You kind of alluded to this, but is it still to be recommended then, if you're one of the people who might be helped by Paxlovid?
Well, I think yes, because even decreasing the severity of the illness makes a difference. It keeps you out of hospital, which is, the most important thing right now, because we just can't keep putting strain on the healthcare system, as we were talking about at the top. So I think there is still a role for it, but we should remember there are a lot of people who talk about, well, we have Paxlovid, we don't have to worry about COVID anymore. It's like, well, I'm not sure Paxlovid is going to get us out of this entirely. It is one tool amongst many. It has its function, but it has its limitations, and not just the rebound phenomenon, but also, the timing. You have to get it done and get tested within a certain amount of time to be eligible. There's a lot of drug-drug interaction. So again, important not to understate the effectiveness of the medication, but important not to overstate it either.